What are 3 good reasons to get the shingles vaccine? Shingles is also known as herpes zoster. It's a reactivation of the Varicella zoster virus, the same virus that causes chickenpox. The #1 reason to get the shingles vaccine is that it's effective. It reduces the risk of shingles by 50%, and it reduces the risk of post-herpetic neuralgia by 66%. So it can be very effective. That makes this vaccine absolutely worthwhile. Another good reason to get the shingles vaccine is to prevent the complications of getting shingles. Shingles can be painful, but it can also cause a thing called post-herpetic neuralgia, which is a pain syndrome that stays for months or even longer, even after the rash is better. This can be debilitating and it can be difficult to treat. Even if it's treatable, that means you'll be exposed to some medications that you wouldn't otherwise be if you didn't have the shingles or the post-herpetic neuralgia in the first place. So getting the vaccine can reduce your risk of getting shingles and of getting shingles complications. Another good reason to get the shingles vaccine is that if you get an episode of shingles, you're not just putting yourself at risk. You can be contagious when you have the herpes zoster eruption. So other people could get the chickenpox, and that can be serious in a kid, in someone who's immunocompromised, in someone who is expecting a baby. So don't just protect yourself, but protect the other people in your life. If you've been vaccinated before, you might need a booster if it's been 10 years. And if you've had shingles, you can still get the vaccine. It could help to prevent another episode. There is treatment for shingles. There's a vaccine, but also if you're treated with antiviral medications within 3 days of the onset of your shingles rash, it can really reduce the pain and symptoms that you're feeling, as well as your risk of having shingles complications, like post-herpetic neuralgia. The other thing to know is that about 20% of people can have involvement of their eye. That's called ophthalmic herpes zoster. That can be very serious, and it usually means that you should see an eye specialist, like an ophthalmologist. In addition to the antivirals, if shingles is affecting your eye, you might need some other treatment too. If you have an episode of shingles or herpes zoster, you can be contagious even before the rash appears. So that's another good reason to get vaccinated, as well as to always use good hygiene practices when you're interacting with people who might be immunocompromised. Herpes zoster can be serious. It can involve the nervous system and the eye. It can cause complications like weakness and confusion. There can also be secondary infections of the rash lesions, and those can be very serious too. People who have an episode of shingles seem to have a higher risk of stroke or heart attack for about 3 to 12 months after their shingles episode. We're not 100% sure why, but that just underlines that it's a serious condition. Thanks for watching, and we'll see you next time on The Wrinkle. Are you getting enough wrinkle? Let me rephrase. Are you getting enough of the wrinkle? If you like this video, please hit the thumbs up, and if you didn't, give it a thumbs down, but please hit the subscribe button and the little notification bell, and that way you'll never miss a video. We do upload twice a week, and we have our Jerry Minute on Twitter and Facebook twice a week as well. All the links are below. I'd love to hear from you. Please leave a comment, and I'll see you next time on The Wrinkle.